if there's no communication, there's no care, right? So with that in mind, every single time I've interpreted, I have validated the fact that if I was not there, then whatever it was that was supposed to happen wouldn't have happened.
BoostCast listeners, download our free healthcare interpreting report. Interpreting gaps are still putting patients at risk. Get the latest data, trends, and insights from over 270 healthcare professionals in BoostLingo's 2025 Healthcare Interpreting Report. Download it now using the link in the description. Welcome back to BoostCast. I'm your host, Dieter Runge. Thank you so much for joining us here. My guest today, Tatiana González-Cestari, Ph.D. CHI Spanish, has 23 years of combined experience as a pharmacist, as a pharmacologist, a researcher, a professor, a leader, and a remote interpreter. Tatiana is passionate about quality research, innovation, compliance, and cultural sensitivity. She serves as the director of language service advocacy at Equiti, where she focuses on hospitals' language access best practices and impact on quality, compliance, and financial metrics. Tatiana is also part of NCIHC Policy, Education and Research Committee, the SAFE AI Taskforce, and is co-author of a very fantastic book called The Remote Interpreter Textbook. Tatiana has mentored, developed training, presented at national and international events, published peer-reviewed and non-peer-reviewed articles, and lectured at various universities. She obtained her pharmacy degree and her Ph.D. in pharmacology from Universidad Central de Venezuela. And shameless plug, of course, Tati and I worked on the remote interpreter textbook. So it is an absolute delight and pleasure to finally get a chance to have you on BoostCast and talk about language access. And welcome, Tati.
Thank you so much, Dieter, and thank you everyone for being here and listening to us. I'm very excited to be here, and yes, it's been really great to have this platform and also meet you through the remote interpreter textbook, and of course, a lot of the folks involved in that project.
Yeah, we'll give a quick shout out to all the other authors: Danielle, Sarah, Catherine, Caroline. What a great adventure that was. Who knew when we started that project, right?
Yep.
But a labor of love, and obviously it was fantastic to connect with so many talented authors on that project. And what's great about it is whenever we show up at different language industry events or healthcare industry events, we tend to bump into each other and continue our adventures in that space as well. So anyways.
Absolutely. Mm-hmm.
Tati, I think for the benefit of our viewers and listeners, I really want to do a quick sort of, I give a little bio overview, but maybe give us a little bit of background on what led you to your current focus in your career on language access in healthcare.
Well, as you read, I have transitioned throughout my life. I've worn many hats, different hats. And even within the language industry, I've been in the language industry for 13 years now. I started as an interpreter, and I also led our Marty's Interpret Education and Compliance department for a while, but then transitioned to what I do now, that it's more focused on providing best practices to hospitals and those who are more in direct contact with the individuals who need language access services, whether it's a patient or the healthcare provider. So in reality, the reasons why I started focusing a lot more on that in my career, not only my career, but my role in this field, it was the lack of visibility and lack of knowledge of the industry by those who may need the service or those who make the decisions to have those services in healthcare systems here in the United States. I would say that also the lack of knowledge and advocacy by the actual members of this industry, because I've noticed that even though this is a very big industry that also has great monetary foundation, let's just put it that way.
Yeah.
Many of us don't really know much about our own industry. So I started doing a lot of work about, spreading the word and educating people and educating myself to educate others on what's going on in the industry. Why do we do things in one way, not another, etc., and how the dynamics are in different areas of the United States or outside of the United States.
Yeah, it's pretty interesting sometimes how invisible the language access and language services space is inside certain sectors of an industry, and certainly in healthcare where it is quite prevalent. It's still quite interesting that it just surprising sometimes that you are in a constant cycle of educating the purpose and the services and the reason behind it. But it's as an industry, we have to perpetually advocate, and you are an advocate, so it seems that I think you're uniquely qualified to do that within the healthcare space. And I think for our listeners and viewers as well, probably need to put a little historical on it. You've had an adventure now with Equiti, but Marty Cloudbreak has gone through some transitions. Obviously a very prevalent and important healthcare technology organization, but I think you've sat at the same desk and had some new names that have transitioned, and now finally Equiti, which I think is a really cool name, by the way. I think
Thank
great.
you.
It is actually a very inspired name for a healthcare technology company. So.
Yeah, I would say yes. The name of the company has changed over the years, at least the years I've been there. But the service, Marty has, it's the constant. So yeah, we'll continue to.
You'd have to be living under a rock if you didn't know who Marty Cloudbreak was, I think, in the healthcare space, right? So does your role as a director of language services advocacy, tell me how that intersects with technology and patient care? What does that look like?
I think my role intersects with a lot of things, a lot of subfields within our industry. And I always tell those who created my role in the company that they had some sort of vision in mind, but they also wanted to leave room for what else was coming, because this industry evolves rapidly. So it definitely intersects with technology, with patient experience. It intersects with multiple ways, any way available to provide language services. Also intersects with patient outcomes and all that kind of stuff. So with the various hats that I've worn in healthcare as director of language service, it's language service advocacy. Also here at Equiti, I'm one of those advocating for hybrid approaches to language access, and that includes technology. Technology is immersed in almost every aspect of language services. Sometimes people don't see it, but technology is there for scheduling of interpreters. Technology is there for in translation portals, in quality assurance, in training, of course, in remote interpreting, but that's in telehealth. But those are like the two things that people tend to think about, and not the rest. Okay.
Right.
So it's almost like, imagine doing your work now without a computer all the time. It's not conceivable anymore. I'm also the one monitoring how language access, or the lack of language access, affects patient care in general and specific ways, and how technology may impact that language access, or the use of certain technologies or modalities that use technology in language services impact other things, other factors like patient care, patient outcomes, etc. So I'm everywhere.
Well, I definitely want to drill down on that, especially on healthcare outcomes. drill down on that a little bit in our chat today. But I'm interested to get a sense of what misconceptions do you think folks have about language access in hospitals and in clinics? I speak with a lot of healthcare interpreters, and I hear lots of really interesting stories. But I would love to get your take on some of the misconceptions or preconceptions, even that folks may have that you have to contend with on some level of frequency in your role.
I think there are several. I will start with one that came like this as you were talking, and is the fact that many people still see language access services as an expense, only an expense, or just a cost center.
Yeah.
They don't see, the return on investment. And most likely it's because they haven't looked for it.
Right.
That's something that I've seen that it's constant. As I'm in this role, I interact with a lot of our clients and the community, and people talk about, yes, we need language services, but more and more budgets are tight in our hospitals, and they need to rely on data to make decisions. That's, like any other organization or business, you rely on data. So where's the data that really tells you, oh, this service is needed so that you can actually have patients and you can serve them? Another misconception is that it's something that anyone can do. Like, oh, language services. Oh, let me just bring, so-and-so who I know is bilingual, and she's going to help us. I don't know. It might be a nurse in a hospital. Oh, nurse ABC. Let me call her and she's going to help us here. Yeah. It's a lot more than that. It requires a lot of preparation, training, and to put together a whole program in a system takes, investment, takes people power, a lot of resources. So that's another misconception. Like, oh, anyone can do it.
Well, yeah. I mean, that story is you hear about it all the time. It's grabbing somebody off the nurse's station because they're bilingual, and just a lack of understanding of just being bilingual in and of itself does not make you an interpreter. I don't know how many times we've had to have that conversation, right? So it's a challenge, and not to mention the liability issues that could swirl in and around bringing someone in to interpret, whether it's a family member or hospital staff, and heaven forbid they get it horribly wrong, or cause any kind of disruption to the patient service, right? So if you can't communicate with the patient, you can't treat them. But even worse than that is providing inaccurate or ineffective interpretation services, or potentially harmful.
Mm-hmm. One thing that I've been mentioning a lot lately is the fact that people don't realize that, let's say, interpreter services or translation services are not just there for the patient. Yeah. Also, that other person who doesn't share the same language with the patient needs the service. So it's for everyone who is in an environment or in a situation in which they cannot communicate in the same language. So I tend to talk more about that because we don't realize that in some areas in the United States, if you're a healthcare provider and you don't share the same language as maybe 40% of your population, that means that 40% of your patients are not going to be treated by you, or they're going to go to another facility where they do offer, or they do have either language concordant care or interpreter services, etc. So it's not just for the patient. And this is something I do often in my role with Equiti, is advocating for that. Like, it's not just, the patient, and back to it's an expense and it's difficult and it's complicated. No, it's also for your healthcare providers to be able to practice. Okay. Otherwise, you may not, you wouldn't see 20, 10, 40% of your patients.
Yeah. It's a very, very real challenge, and especially healthcare professionals have limited time to see and accommodate their patient needs, right? And so language access becomes a massively important component to affecting that service for those patients. So it leads me to my next question, which is, can we maybe do a little bit of a dive into some of the real world examples that you've seen? You've been an interpreter and also been on, putting together programs for healthcare organizations and see all of it. Maybe some examples of how how language barriers can directly impact that patient care. Like some specific examples that you might think of that.
Yeah, well, every single call or every single, encounter I've had as an interpreter has given me that experience that I'm doing something to help others. And so every single call has a story, and it will be a good testimonial for your question. But I would say in general terms, communication is the most important diagnostic tool. So in addition to that, just that gives you, the idea of if there's no communication, there's no care, right? Yeah. So with that in mind, every single time I've interpreted, I have validated the fact that if I was not there, then whatever it was that was supposed to happen wouldn't have happened.
Yeah.
So if it's, someone giving birth or someone, receiving bad news because they were just recently diagnosed with cancer and they need to make decisions about the type of treatment they're going to obtain, or if they are not going to receive any treatments at all, or, if the family wants to circumcise a baby boy or not, or if the mom is going to breastfeed or bottle feed, or you name it. Like, so many decisions are being made during these encounters. Every single time I've interpreted for two people who don't share the same language, I know I'm making a difference and I'm breaking down those language barriers. So I've seen a lot of things, and I see it even when I witness other people interpreting, or so I see that impact on patient care every time, and how also when you get to a room or you join a conversation through video or audio, and nurses, for example, may tell you, oh, the patient doesn't want to talk to us, or the patient is confused. The moment you open your mouth and you speak in that patient's language, it's like something magical happens, and they start talking, they start trusting, all that. So that also affects patient care, and that helps build rapport, which is extremely important, and trust in any relationship with your healthcare providers. And I'm telling you this, and I'm thinking about my relationship with my healthcare providers.
Yeah.
So, yeah.
Yeah, it's terrifying to consider. I mean, if you consider, finding yourself in a hospital in a foreign country, or in a country where you don't speak the dominant language very well or at all, and in those moments, when you're in a hospital, it can be bewildering. It can be very, very, a very scary situation. So, that ability to communicate your circumstances, what you're feeling, all of that, so critical, particularly in moments where folks are, stressed out. It definitely brings that stress level down. And I think it really just cuts across all areas of healthcare, right? It doesn't really matter. And interpreters are usually in pre or post operative, or moments, pre and post usually, right? But sometimes in the ER, sometimes in triage moments, right? I mean, that happens to some extent. But I think that, I'm sure you've seen it across any, you talk a lot about, the childcare space. Definitely it's very important. Obstetrics and childbirth and all of that, but also, in giving pharmacological guidance, after a procedure, or if someone's been diagnosed with a particular issue, and those require, modicum of just understanding and experience from having been through that a few times. So maybe
Yes.
do you have some examples that of that where as if, putting your interpreter hat back on, moments where that was the incremental difference, your ability to connect what needed to be communicated from the patient to the physician or to the hospital care staff.
Yes, I have plenty of those too. One that comes to mind is when I have interpreted for patients before and after a transplant, maybe a kidney transplant.
Yeah.
The list, this is one of the extremes. The list of medications patients need to take is
exhaustive.
We're talking about maybe even 30 different types of medications, and they need to understand why they're taking each one of them, how they're going to take it, if they don't take it at the right time, what to do, if they have any interactions with foods, other medications, diagnostic procedures, etc. So they have to learn all of this. So it's crucial. When they don't have that knowledge or education, they may even start rejecting the new organ right away, or whatever preparation was done ahead of the surgery can fail because somebody didn't follow the instruction. When I say somebody, because many times it's not just the patient, it's the support system helping the patient get to where they need to be. So it's a lot of communication there. So I'm going to the extreme with like a lot of medications and all that, but it could be just, I knew enough English to kind of understand what my doctor said, that I need to take this medication as needed. And not even English speaking people really truly understand the as needed. So it's not when I think I'm going to have, let's say, the pain, it's when I know I'm having the pain. So it's these type of things come up frequently in any healthcare conversation. And when I've seen it, let's say a patient comes into a clinic and they ask, well, why didn't you take this and this and that? Or why did you take it? Well, I understood you said blah. And then as an interpreter, you note, let's work with an interpreter next time. And I'm interpreting all this. So I noticed that in the past, there was lack of communication, or there was no effective communication. And that was definitely affecting the patient's care and treatment and treatment compliance and all that.
Get the global go-to guide trusted by professionals across the language services industry, The Remote Interpreter. This essential textbook is designed for interpreters, trainers, and organizations navigating the fast-changing world of remote interpreting. Written by 7 industry experts, The Remote Interpreter combines insider knowledge, cutting-edge technology insights, and step-by-step guidance to help you master remote setups, workflows, and best practices. Whether you're an experienced interpreter or just stepping into remote work, you'll find practical exercises, informed process tips, technology guidance, clear, accessible language that makes complex concepts easy to grasp. Comprehensive, practical, expert-led, it's a must-have resource for anyone working in remote language services today. Exclusive for BoostCast listeners, use your special promo code to unlock a publisher discount. Now available in both print and ebook from Culture and Language Press.
Let's maybe talk a little bit about collaboration with language access providers, interpreters, across the whole spectrum of stakeholders a little bit. What should healthcare professionals, let's start with healthcare professionals. What should they know about how to work more effectively with interpreters? How do you advocate and message around that?
How long do we have?
As long as you need. As long as you need.
No. I get excited about these things, so I can
Yeah.
talk to you about this forever. But no, in brief, first of all, we are professionals like any other professional, healthcare professionals included. And the best thing to do is learn from us. Allow us to give you certain instructions, and some people call it like an introduction, allow the interpreter to introduce themselves, or a pre-session or something. So give them the chance to tell you what to do or not to do, unless you're very seasoned, as someone working with interpreters. But here and there, you may have different dynamics. So it's always good to allow interpreters to let you know what rules or what's going to be the dynamic of that session. And then if you're working with spoken language interpreters, and if they tell you pause often, all that, try to respect that. Use short, concise sentences, or at least give your ideas in a clear way, so that when you pause, the interpreter can clearly convey that message in the other language. And with that, if it's simultaneous, because that's the other modality, mode, it's simultaneous. If that's the case, the interpreter will tell you, you can continue talking and I will simultaneously interpret for you. And that can happen in spoken languages, and it's even more frequent with sign languages. So those are, things that help us a lot as interpreters. Don't try to mix the languages. If you know that this happens to me often as a Spanish speaker, people want to practice their high school Spanish. It gets a lot more complicated, not only for the patient to understand, but for us to interpret. If you start a sentence and that sentence has 12 words and you say 5 of them in Spanish and just sprinkle them in, the patient is like, wait, he said what? But you're saying what? Like, this doesn't make any sense. So it's really confusing. I don't know if that's as frequent with other languages, but in Spanish, it's common. So we advise healthcare providers just to stick to one language. If they're very fluent, I've worked with many providers. This was great. This is an example we need to mention here. This neurosurgeon was very fluent in Spanish, but he said, I know what's at risk. So I want to have the interpreter here in case there's something that I'm missing. I get stuck. I don't remember a word. I don't know a word in Spanish. So I want to have you here. And that's fine. The interpreter can do that. That's what we call shadow interpreting in some areas here in the United States. And I stay there. The neurosurgeon communicated in Spanish most of the time. It wasn't until one of the technical terms that he was using in English, or he was trying to find it in Spanish, I guess, in his brain, and then he paused, and then he turned to me and asked, how do you say blah, blah, blah in Spanish? And I went ahead and provided that, and then he continued. But I was monitoring, I was actively interpreting in my head as he was talking, and following the conversation in case there was a time where I needed to step in. So that was great. Like, if you know enough of the language, you consider you can do it, go ahead and do it. But be also humble enough, like this doctor, to have the interpreter there in case you get stuck or you don't understand something coming from the patient, you name it. Like, there's so many different things that
there's a lot going on in those moments. Focus on the physician part, and we'll focus on the language part.
Yes,
right?
Exactly.
No, I mean, it's nice when that fluency is there, but as you say, leave the interpreting to the professionals.
Absolutely. Yeah.
For hospital administrators and care managers, how can they become like how can they become stronger allies to someone who is providing this language access and language, equity in the hospitals and the clinics? What is one way, or what are a few ways that folks across the healthcare space can become a better ally for what you're doing?
What I've seen in many years, my many years interacting with many of, let's say, our Marty clients or, the industry, is that if you need to convince someone, you look for the things that this audience prioritizes. So, think about how you convince your kids to do something that you want them to do. I know it's not the greatest analogy, but it has the same fundamentals, right? So you look for things and use things that this audience cares about. Yeah. Is it quality? Is it risk or risk mitigation? Yeah. Is it experience, like, patient experience or user experience? Is it finances? Is it efficiency? So anyone who's trying to make this industry more visible and advocating for it and trying to gain more allies, we need to be able to speak all those languages or speak to the different things that they care about. Not that they don't care about the other things, but they need to prioritize certain things. If you're in a financial department, you need to prioritize finances. Okay. Yeah. That doesn't mean that you don't care about the rest, but you need to make certain decisions that are based on that. Same with, let's say, patient experience or risk management or language services or marketing. You have to be able to speak their language, or and not that you're just giving them information for the sake of it. No, make sure that what you're providing, it's really something that will be important and useful to them. So to me, it's just a matter of trying to speak the same language in this industry. Yep.
Yeah. We both work with language service providers, language service agencies quite a bit. Mm-hmm. And one of my questions would be, where do you see, what are some of the communication gaps that exist in between the agencies and the language service providers and the healthcare systems today? What have you observed in terms of the way that LSPs engage with the healthcare system today?
I would say, I think I'm going to go back to what we were talking about in the previous question. It is the fact that we don't speak the same language. Even though we may all speak English, let's say in one environment, or we all speak Japanese in another environment, we're not speaking about the same things. And we're not used to speaking in the same language, in the sense that we have not prioritizing the other's needs, or we have not provided, for example, I would say the language industry and the language service companies and providers have not given the healthcare system or hospitals and clinics what they need in order to understand what we do. So to me, there's a lot of research that needs to be done and a lot of education, like internal, like we need to educate ourselves and generate the data to be able to educate others on what is it that we do, what's the impact of our industry and our services on their own metrics. And I say, part of speaking the language is also, it's providing what they need and showing them how our services impact everything they care about. Whatever it is that they have to prioritize, I'm sure communication is somewhere in there. And if there's no communication, then there's no good outcome in any way. So to me, it's a lot of trying to speak the same language as the rest.
Tati, one of the questions I think would be really important to ask is around the KPIs and data points that hospital and healthcare provider leadership teams can track when engaging with LSPs and language service providers. I think understanding some of the important metrics that they can use to evaluate the kind of service that they're receiving. And I think it'd be important for LSPs too to understand what they should be working towards or working to engage better with healthcare organizations. What do you advise there?
Yeah, to me, well, first of all, I think this is a very important question. And I would say that anything that can provide information about performance is important. And when I say performance, it can be in the form of good or bad performance or of an interpreter, good or bad performance of the platform that I'm using to schedule my interpreters, good or bad performance of the translated work, good or bad performance of I'm going to make something up, but, if we're using technology or certain, devices, softwares, like if, how long has that been down? For how long? Like anything that can track performance, even for your on-site interpreters. If you may evaluate their performance based on accuracy or their customer service, or if they're on time for their assignments. Same thing in remote interpreting. So you can measure how long it takes for a person to join the session, or you can measure satisfaction, and it could be satisfaction of different users. It can be satisfaction of your own linguists, and how satisfied they are with the technology utilized to provide the service, for example. Specifically for, those are many of the things that the language companies can be tracking, so that we are ready, and they're ready, all of us, we're in the same industry, we're ready to really talk to the healthcare systems about why I say my services are good, or why I say that the quality of the services provided is high enough, or the greatest of all the ones, compared to the other companies, or however it is that we want to say it, we need to back it up with data. It cannot be something like, okay, Dieter, tell me why you think BoostLingo is the best company to provide services to my organization. And you go, you know what? We have a great training. Okay, great. How do you prove that? Right? So I tend to play devil's advocate when it comes to these things, because it has X amount of hours. Great. Where's the research or the data telling me that the number of hours necessarily defines how good that training is? And then have you measured the outcomes of that training? So we may not have the perfect situation or the perfect set of data, but the more you dig into the performance of your programs, your let's say your training and all that kind of stuff, the more you can provide to the hospitals, and the more they can see you as a true, let's say, high quality company. Yeah. It's not just, because I think it should be this way. I think I'm the best. Yeah, we all think we're the best, right? So it needs to come with data. And it's tied to what we were talking about earlier. I was reading an article a couple months ago about patient experience, and how a couple of decades ago, patient experience was something like, people were like, well, I think it would be nice to ask people how they're doing, how the experience is when they come to hospitals and clinics. But it was the nice thing to do. I mean, if you think about patient experience now, it's loaded with data. It's a field that it's really making decisions based on data. Yeah. And they're without, of course, losing the human side and the testimonials and all that. But even that, the qualitative data, I mean, that field now is full of both quantitative and qualitative data. And now it's very robust. And now most people, I would say, at least I haven't encountered a person who thinks, we don't need patient experience in our hospital. Because if you don't have that, people will go to another hospital. So that's, to me, it's what this industry needs to do. We need to get to that level of, nobody think about not having language services, if that makes sense.
Right. Yeah. And I think a lot of times that data exists. We collect a lot of data, but we tend to not use it. And it just, it can be very valuable in determining, and as you say, helping substantiate, why hospital XYZ should be working with your services, right? So I think looking internally at the data that exists and monitoring each engagement as best you can, and using technology to some extent to capture that, because you're right. Data tells a very powerful message, and it's a much more compelling conversation to have when you can back up your claims with the data. So I think data-driven decisions, man, that's what it's all about, right?
Yep.
I want to talk a little bit about compliance, regulatory compliance issues, which are obviously very, very important in the healthcare industry and in the U.S. and beyond. Tell me a little bit about how compliance mandates, for example, Section 1557 of the ACA, how does that play into the day-to-day delivery of language access? And we live in some interesting times right now in terms of regulatory compliance and where things are headed. But I know you sit on a number of organizations, including the SAFE AI group. Fantastic. Love a lot of the stuff that's coming out of that think tank. But what's your take on these compliance mandates, where we are today, and what how will this, what is your current take on where things are today, and how will that affect language access today and tomorrow, I guess is my question.
Yeah.
I know it's a loaded question a little bit.
Yes. But well, let me break it down. Okay. So these mandates, these regulations, including Section 1557 of the Affordable Care Act, mandate, for example, the language services are provided at no cost to the patient. So let's start with that, right? It also has there that hospital staff must know how to access such services and provide them in a timely manner. People don't tend to see that or know that, but that's part of the mandate, right? The ADA has also specific requirements for providing interpreter services to individuals, let's say, who are deaf or hard of hearing. There's also things that we need to consider when providing resources to individuals who are blind, etc. So all of these have a lot of things that we need and that we are part of the day-to-day in delivering language services. But honestly, I want to go even beyond that. So this industry has talked a lot over the years about language services is the right thing to do, or it's needed because it's the law. But more and more, I notice, and thankfully, research has started to come out about the fact that hospitals need this because, one, they may see a reduction of length of stay, readmission rates, other things. So even though we could continue saying, yeah, it's the law, it goes beyond that. It's now, you need to be smart about this. If you're in a hospital, you're part of the hospital administrators. It's not just the nice thing to do, the right thing to do, or the law. It goes beyond that. And now I'm going to talk like business. If you see things as a business too, you will see the impact, the monetary impact that these services, positive monetary impact that these services have. So yes, they're still, and they're, as you said, there are many moving pieces right now. They're all moving at the same time when it comes to, federal regulations and all that, or local regulations. But I think we've talked a lot about this, and I mean, the industry has talked a lot about this. But in reality, we need to find a way to move past that, or to now become the, patient experience. Like, we're going to give you data that's so powerful that even if at some moment, at some time, we don't know, even if it's not the law, I'm not saying that Tatiana is not saying that this is not the law, but if at some point in the life of this country, that is not the law, you still need it. It's like washing your hands. Like, you still need it. There's no law that tells you to wash your hands, right? But you still need it, right? But you know that you need it. Same with, I always give the analogy of soap. Nobody's telling you that you have to buy soap and you have to have soap. Yeah, are you going to just buy soap for half of your hospital and then the other half is not going to have it? No, you need to plan and have it there because you know it's needed. Same thing with us. The political, the regulatory, all that may change. We don't know. It may or may not. But if it does in a negative way, then we're ready for it. The industry's ready for it if we build that infrastructure.
Yeah, you touched on, when we started talking, you touched on how language access has traditionally been treated like a cost center, as, rather than an essential component to patient safety and better patient outcomes. Not everywhere, but I think healthcare providers see that even if it's not, certain things aren't mandatory, that language access, not having it to save a few dollars here and there is a false economy, right? I think if you work in healthcare and you are prevented in communicating with your patient, it has real, repercussions if that doesn't happen, right? And I think most healthcare, I would like to believe that most health providers that are sort of in there on the day-to-day basis see that and believe it. The ACA has been kicked around, for years and years and years, and I still see hospitals that are like, we don't care, go on record as saying, listen, we see the value in this, and we're going to continue doing it no matter what happens. And then I also see some hospitals say, well, maybe we'll just use AI to handle it, and I think that hospitals will find a blend of AI supported language tools out there. But I think human in the mix is still going to be very, very, very important. I don't know how do you fall on that one? Like, we've got so many different, we've got government regulations coming at us, and we've got generative AI technologies coming hard and fast at us. It's like the perfect storm of transformation across the language industry and the healthcare industry. So, where do you fall on some of that, I guess, is my question.
I think I'm with you. I agree with what you're saying. It's another tool. It's something that we all may utilize for certain things. Just like any technology and tools, they can live with us. We can utilize it, but it doesn't have to replace others. We have, platforms to stream music and all that. We still use the radio. Some people may need to still use a fax machine for certain things. So many times these technologies coexist. And I think I heard this from Renato Beninato at the Vamos Juntos conference, that we fear all this so much, but we don't realize that another tool, just like the other tools that have been developed in the past, and many of these tools and technologies still coexist. So to me, it's a combination. I say it's the smart thing to do, to look at all of these tools and technologies and maybe use a combination of them, but adding the human factor there for sure. Like, it's just like you were saying. Mm-hmm.
Well, I'm conscious of the time here, but I wanted maybe to summarize, get a sense of where we're headed with this. Being a director of advocacy, how do you think that the language industry can do a better job of advocating for itself within the healthcare system and beyond that. You can't scroll through LinkedIn or on some of the Reddit channels or anywhere on the internet these days and not get sucked into a conversation about how the industry is transforming right before our very eyes. But we have traditionally, I think, not done the greatest job of selling the brand of language access in the past. And there are some folks that are the LangOps movement. Slater recently renaming, what we call ourselves. And I, you know what, I kind of champion that. Anytime that you can do a fresh rebrand to get it back into the psyche and the mind of folks that use this service that is largely invisible and until you need it, and then you really need it. That's my long-winded way of asking you, as a director of advocacy, what can all of us in the industry do to better advocate for ourselves? What do you think are some of the tangible things that can happen right now?
Well, in short, the researcher in me is going to give you the sentence of publishing reliable data from research. That's, as you said, many of us are doing research, but the publications are still like, there are tons of publications out there, but they're not necessarily, the research is not necessarily answering the questions that this industry needs answers of. So research, publication, we need to stop that fear of publishing data because we're not going to go anywhere if we continue that way. So that's going to be our biggest, strongest, I think, piece of ammunition to talk to people and to make this industry more visible and reliable and trusted, all that. So that's how I see things. And it may be from my research background, like you have it or you don't have it. And only data can prove that. So that's, of course, I'm not talking about, an experiment, just a simple experiment. No, these are lives of people. We're talking about people. So that component needs to be always present. But data is what, to me, is going to move the needle from where we are to where we need to be.
Yeah. Well, that makes a lot of sense. And like we said earlier, the data-driven decision is going to help validate the continued need for language access and language services out there. So, Tati, thank you so much for jumping in on BoostCast with me here today. Are you headed to any cool events coming up through the next quarter at all? To the end of the year? Anything exciting on the horizon for you?
Well, first of all, I'm super excited to be here. Thank you for inviting me. It's been a pleasure, being with you in this conversation. And yes, mostly in the month of September, we have the NCIHC Language Access Congress, the Texas Association of Healthcare Interpreters and Translators Conference. There's so many things going on, like starting in September, the ATA conference in October, and many more. But yeah, those are some of the ones that I'll be going to. Awesome.
Well, yeah, I'm always excited because, our little group of co-authors, whenever I get a chance to reconnect at industry events, that's always good. Hopefully see you in Buenos Aires next year, maybe.
Maybe.
Right? Fingers crossed. And everyone who joined us here today, thanks so much for tuning in. And please follow Tati and her exploits and adventures in advocacy for language access. And thank you for joining us here today. We'll see you real soon.
Thank you. And thank you, Dieter, and for being an amazing host, and BoostLingo for everything.
Thank you so much. Speak soon.